Dr. Richard Shaker is a chiropractic physician specializing in sports medicine and also a patient. He well understands the cervical, cranial, and mandibular structures that can be misaligned from sports injuries, as those injuries can and will negatively affect the whole body. As he says, this area is grand central for what matters to your health. When I see a patient who talks about headaches, sleep problems, numbness, tingling, or any kind of discomfort, we know something has gone wrong with the chewing cycle. And this is a health problem in the making. Whether it's from injury, tooth wear, incorrect placement of crowns, tooth grinding at night, infections in the jaw from microorganisms, or even from metal toxicity, we are looking at something that needs immediate attention. Correcting structure restores proper flow to the nervous system and energy pathways flowing through the fascia to every cell in the body. A body robbed of energy is on the way to poor health. Dr. Shaker and I work together on these structural problems, and his comments validate our natural dentistry approach. This is important to you.
Dr. Bem deals with the function of the jaw and the teeth as they come together during the chewing cycle. And people should have a normal bite. As we get older, our teeth wear down from all the biting and grinding. That alters the neuromechanics of the mouth. Having one leg longer than the other, not having a proper mattress, not having a proper pillow, having bad dental work done, having metal put in your mouth, which I do not recommend. There's actually a chewing cycle that occurs in the body, just like what I do. There's a walking cycle. People walk properly, but actually these two systems actually they interconnect and they relate to the entire physiologic function of the whole body. And the TMJ joint, the temporomandibular joint, is the most used joint in the body. It's used about 2,000 times a day. Most of the mechanoreceptors, which keep you in balance in the body, are located in the back of the neck, the occiput area, and also the bottom of your feet. So when the mechanics of the temporomandibular joint are altered, it affects these afferent nerves that give sensory data back to the body, back to the brain, through the spinal cord, which runs down through your spine, and actually then the nerves go down through your legs and into your feet. So that whole system that actually starts up here gets interrupted, and therefore that communication is not properly presented to the feet, and therefore the information back from the foot back through the spine to the brain is not functioning properly as well. So Dr. Bem and I are both full body practitioners. Actually, we have to understand these concepts. Dr. Bem is a pioneer in kinesiologic dentistry, which basically means movement, which is, to use a colloquial simple term, a chiropractor of the mouth, basically. So he's, adjusting the neuromechanics of the mouth, which is vitally important to health. And I know how to adjust the TMJ, the cervical craniomandibular apparatus. I also do a technique called trigenics out of Canada, which upregulates the neurophys of all the TMJ jaw muscles. So we actually treat those muscles directly through neuromanual methods. So actually the best treatment protocol would be to see Dr. Bem and myself concurrently, and then you're going to get a much better result. So for me personally, I had previous dental work that did not work out for me, unfortunately, and created several chewing cycle issues. And so now I'm on the back end of Dr. Bem with his amazing system that he has. He has a terrific computerized system. They do EMG testing. The LVI Research Institute that he goes to, they have produced incredible research on actually what muscles fire and in what sequence they fire in order for this apparatus to function properly. And his staff is highly trained to interpret this data and therefore create an exquisite bite. What it did for me, and personally, I'm breathing better, I'm articulating better, I sleep better. I noticed that my sleep quality is significantly better, probably because I'm breathing properly. So when the bite is altered, it alters the position of the tongue in the mouth, and people develop, the common term now is sleep apnea. It's becoming very popular now, unfortunately. And so Dr. Bem and his staff are able to really make a huge difference for people as far as increasing their strength, their mobility, their balance, their pain, and your entire quality of life. I mean, if you just think about it, I mean, I'm sitting here talking to you right now, and I'm not really using my feet. Everything is happening up here. So just from that perspective, there's a lot going on up here. This is central command, right? The brain is right here. Just from a common sense perspective, the spinal cord is right here, the brain's here, the TMJ is here. So I think really all physicians need to be aware of this area. Trigenics is out of Canada. It's a 3-year postgraduate course that I took. Phenomenal for feet, knees, wrists, hips, shoulders, jaws. So that's really what I enjoy doing to help my patients out. And I can be found at drshaker.com.